As we age, so do our eyes, a natural process that increases the risk for age-related eye diseases and conditions. These include cataracts, the second most common cause of vision impairment in the world. When the eye's natural lens begins to turn cloudy, vision becomes hazy, focus is difficult, and glare affects your eyesight more. While most cataracts develop over time as part of the natural aging process, other factors like diabetes, smoking, and high blood pressure increase your risk of developing cataracts. Many patients are surprised to hear they have cataracts because while cataracts can occasionally develop rapidly, the changes to vision are often very gradual. However, over time, cataracts can greatly impact vision, making driving, reading, and other daily activities more difficult. If we diagnose cataracts early enough, vision can be improved with non-surgical methods such as new eyeglass prescriptions, anti-glare sunglasses, brighter lighting, or magnifying lenses. But once cataracts advance, cataract surgery is the only effective treatment. Thankfully, cataract surgery can restore your clear vision by replacing these cloudy lenses known as cataracts with an intraocular lens or IOL. There are several advanced IOL options that can not only restore clarity, but also help you see clearer without glasses or contacts. Cataract surgery is one of the most commonly performed operations in the United States, and one of the safest, with a success rate of over 98%. It's a painless outpatient procedure where most patients can resume their normal activities in just a few days, and after 8 weeks, you should be seeing the same as before, or with the right IOL, sharper than ever.